Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Medicare has covered this. There's still a lot of questions that I get on a daily basis about what's covered, when it's not. And Medicare, over the years, has managed to answer or not answer our questions, as it were, both to billers and coders and physicians, but also to the patient population. The number one myth out there is that Medicare covers an annual well woman exam. Most of your patients who walk in the door assume that's a true statement, but they cover it, and it's now free. That's the way it's been advertised. The problem with that is Medicare, under federal statutes, has never been allowed to do the cover that annual preventive well woman exam that you and I, in obstetrics and gynecology, recognizes as being one. Their idea of the preventive coverage item is a heck of a lot different than what our idea would be, and certainly a lot different than has been published by ACOG and the types of things that your physician performs. So if you have a Medicare patient, you're going to come down to several exam choices that you can make that will, in fact, be covered by Medicare. Although I'm not going to talk about the first two today, it's nice for you to realize that these are also some options that you have. The first is what Medicare developed a couple of years ago called the initial preventive physical exam, the Welcome to Medicare exam. And that particular exam is only covered in the very first year that the patient becomes eligible for Part B services. And when you do that exam, you get to bill for, as an OBGYN, if you should provide that service, you also get to bill for the pelvic exam and the PAP in the covered years. That preventive physical exam that Medicare has developed is very specific about what they will and will not cover. And generally, it includes nothing that an OBGYN would do in addition to a pelvic exam. It's a lot of other types of screening. In other words, their idea of this exam is to fact-find, to discover things that put the patient at risk so that a plan can be developed to help them prevent the onset of illness as they age. That's the purpose of this exam. The second benefit, which just started 2 years ago, is the initial and subsequent annual wellness visits. These visits start in year 2 of the patient's Part B eligibility. The difference here is they are actually not that many differences. The Welcome to Medicare set up the initial program, and the initial and subsequent annual wellness visits continue with that theme, but are more in-depth visits concerning health risk assessment. And in fact, Medicare has said that these initial and subsequent annual wellness visits are not like a preventive medicine service that you would see defined in the CPT book. They are specifically designed based on legislation, and so certain elements have to be there, none of which is a physical examination. So again, if you are the practice that is providing primary care to your GYN patients, and you know that they would not be getting this benefit anywhere else, you may in fact decide to provide it. I would caution you, however, that patients don't understand the difference between the exam that you're doing and the exam that Medicare is paying for. So if you, as a GYN practice, are not going to be providing this Medicare benefit, which to the patient is free, you really should put that in writing and let your patients know that if they need that service, they need to go elsewhere to get it. This is really a benefit to your patient, and it improves their quality of care as well. If you are going to provide it, then again, you'll have to know the specific rules that go along with that. You will have
Supercoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.